When I was a kid, I was fascinated with phones. There was a new landline which was installed in my house, and I loved dialing wrong numbers. You know why? Because we could reach out to strangers who will pick calls and they'll be like, who is this? And I'll laugh at it. Well, that curiosity to do strange things, weird things has still not died down probably. And that's the reason we went ahead and started a biosciences company, Biotechnica. And I'm blessed to tell you this, that in fact, I'm very blessed to be working with some of the greatest minds in our country in the fields of biosciences. One such expert member in our team is Dr. Farhan Zameer. Dr. Farhan Zameer, sir, is highly accomplished scientist. He has pursued research in various aspects of biochemistry as well as molecular biology and bioinformatics. And when he joined us as an expert member, let me tell you, last several years has been a tremendous enriching experience for all of us. We were not at all aware of the power, the scope of genomics, transcriptomics, proteomics, the central dogma of biology, and whatnot. He introduced us to concepts in such a way that our students are fixated to his way of teaching. In fact, let me tell you, there are many students who attended their bioinformatics basics internship. They again went ahead and attended his advanced internship. When in February he launched the Bioinformatics Global Tools and Techniques internship, they attended that also. And now they are a part of the CRISPR Bioinformatics internship. Such is his power and aura. And today, I'm blessed to have him right here, sitting next to me. Hello, sir. Namaskar. How are you?
Sir, namaskar, sir. How are you, sir?
I'm doing great,
Thanks
sir.
for having me here, sir.
It is always a pleasure and blessing to have you here, sir. So, sir, today's meeting, I want to make it maximum fruitful for our students. So I have a couple of questions which I want to start with. Definitely the first and plain question will be obviously because we want to talk about the career and the future scope of bioinformatics and how it will shape up. But let us start from the basic. And the basic is obviously the molecular dogma, the central dogma of molecular biology. So let's start from there and let's build on the top of it. How can a bioinformatician build his career and go forward? So over to you, sir.
Right, sir. Normally when we speak about central dogma, there are two types of central dogmas. One is called as the classical central dogma, and the second part is called as the modern central dogma.
Right.
Now, what you and me, what we have studied is the classical central dogma,
Right.
which had only three components. One was genomics, then transcriptomics, and we had proteomics.
Right.
But however, now because of the advent of technology, the data got accumulated. Now with this huge amount of data, there was no technologies which were able to analyze that data. You'll be surprised, sir, if I take one cell from your skin, then if I sequence it, and then if I project it on a projector, and it would read as just ATGC, 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 can you just tell me what would be the time required to just read that ATGC?
It will be huge. I'm sure it will be too much.
Probably an approximate time, sir?
At least 24 hours?
24 hours. Okay. You would be surprised with my answer. If I take one cell of yours and then sequence it and display it on a projector, this will take you around 180 years just to read ATGC, ATGC. So,
Okay, manually.
Manually.
All right.
So, day in and day out, you will be just reading ATGC, ATGC, ATGC. Now, the reason for me trying to put up this particular analogy is to make you aware that you are just reading the data. Manually, this is called as manual curation.
Right.
You are manually looking into the data. But however, you're not understanding the data.
Right.
Now, there's a difference between reading and understanding.
Of
And
course.
here comes the advent of technology. Here comes the intervention of technology. And very importantly, the best tool what we can use is the computers.
Of course.
Now, using this computer, how can I not just read it, but I also understand the data? And hence, when we talk about the central dogma of molecular biology, it started with genomics, then transcriptomics and metabolomics. Now, this kind of data got accumulated day in and day out. We are talking here, we are sitting here, and then in some place in in the world, the new kind of data would have been accumulated.
Right.
Now, to make you aware, so hence what people taught us, now only we cannot just get abide to the previous classical dogma, and hence two major important components were actually added into the central dogma.
Okay.
And this dogma is called as modern central dogma of molecular biology, which involves, now we started saying that everything started with a gene.
Right.
But now what people have realized is there is something which has been controlling the gene, or there is something which is actually controlling the DNA. And those components are called as epigenomics.
Right.
So now the modern centered dogma starts with epigenomics, then comes your genomics, then comes transcriptomics, then comes proteomics. And we thought, okay, proteomics is the end because every gene would produce a product, and hence that's a protein. But however, now we know that these protein can also undergo further anabolism or catabolism and produce a metabolite.
Right.
And this combination of anabolite and catabolite together is called as metabolite. Now, studying of this metabolite is called as metabolomics. So now, in the modern central dogma, I have 5 major components. That is epigenomics, genomics, transcriptomics, and proteomics, and then we have the metabolomics. Now, all our students have to get empowered with the recent technology. Otherwise, many times we say that we have gained degrees, but however, we become unemployable.
Right.
Now, people will only hire me if they look into the credibility of mine. So finally, how do I become credible? I become credible using my, the knowledge what will empower my system. And once I have the cognitive ability which can actually empower it, the world is yours, sir. And hence, bioinformatics, especially in this particular era, I would always call it as there was various kinds of, revolutions which took up. White revolution, green revolution, blue revolution. And trust me, sir, now we are in a revolution which is called as data revolution. And hence, bioinformatics plays a tremendous role in shaping up the career of life science students.
Right. And it also opens up newer doors of opportunities to our students, that's for sure. And I can see that many of your students who have attended the internship are now getting placed in industry. And that's something which I think all of you should know, that many of our students who have attended the internship with Farhan Zameer sir are now getting readily absorbed into the industry with the kind of thorough knowledge and in-depth knowledge he has imparted to these students. So sir, okay, we understand the modern central dogma of molecular biology, and now you mentioned about genomics. So what kind of genomics related jobs our students can get in the future?
Right, sir. As I was trying to tell you, manual creation was being done maybe 20 years back.
Right.
Now, because of the automation, there is something which is called as automated curators.
Right.
But these automated curators, there's a huge chance that there is many a component. You have a pseudo positive data and pseudo negative data. Right. So how do you fish out the actual readable data with pseudo positive or pseudo negative data? So hence, it is, it is not just, in terms of genomics, it is not just you are trying to do something in molecular biology, especially in wet lab. So here, people are trying to look at genomics at 2 different components. One is called as the dry lab component, and the other one is called as wet lab. And apart from that, there was always a thin line which was bifurcating this as dry lab scientist and wet lab scientist. Now, people are looking for a package.
Right.
Now, when people are looking for a package, I want to employ one person who is proficient in both wet lab and dry lab. And here comes the importance of certifications and internships. So hence, apart from a regular degree, and trust me, sir, I have been a very, very, studious, candidate throughout my career. And till now, people who have offered me jobs have never seen my marks cards. Right. I have been a first rank holder. I have been a gold medalist. Never people, when they offered me a job, they have looked into my marks cards also. What people are looking into is, are you able to execute? So it is not simply that you go and say that I know bioinformatics, but people will give you a small assignment just to know what is your proficiency and what is the grip on the subject. And hence, I request all my students to make a thorough, hands-on components, especially at Biotechnica. You always, always, you always say that it is not just of teaching them theory component. Theory component could be taught using books, and all our students, they know how to read English. So that means to say they can read any kind of a textbook and then they get knowledge. But what we are trying to empower
applied science.
Yes, is to the student should also know the practical hands-on component. So I am actually blessed. You were actually mentioning about the student, but we are blessed at Biotechnica to get good, dedicated students.
Yes.
So that's an added USP. And trust me, sir, our students are our brand ambassadors.
Right.
Every point of time, the level of satisfaction when we finish a certification program or an internship, they say, sir, from tomorrow you're not there. Okay, and sir, we will miss you. But on the way, you have provided a platform so that there is something which is called a lifelong learning.
Right.
And I was actually surprised to know there were certain students. I thought bioinformatics was only for life science students. But however, now I know that there is one student who is from a mechanical background, and from a mechanical background, she is trying to understand biology. Now, I was a bit curious, and I thought that what was the reason of this student trying to learn, a mechanical engineering engineer learning bioinformatics or biology. And what she says is, sir, in all biological systems, I see physics.
Right.
So it is, when you're talking about docking, when you're talking about, a drug interaction, in fact, it is a biomolecular interaction, what she looks at.
Right.
And her purview of understanding bioinformatics is extremely, different than the viewpoint what we have. And it is not just, me teaching my student. In fact, there is a learning from the student also.
Absolutely.
That's an added advantage at Biotechnica, sir.
Absolutely. We always learn from our students and then improve our courses. That's something that I really agree to. So, sir, okay, the kind of jobs now we know for genomics. You also mentioned about transcriptomics, and how does it actually relate to genomics now?
Exactly, sir. When I take up DNA, when I study the genomic component of it, the switches, example, we are sitting in a studio, and if there is the lights, if they're to be on, so there is a switch which is actually regulating.
Right.
So for this genomics, for the DNA, okay, the switches are nothing but your RNA. So for a gene to get upregulated or downregulated, the switch is in the RNA. So I need to study, especially the mRNA component, to understand whether in a particular scenario of a disease or a disorder, whether a gene is getting expressed, that is upregulation or downregulation, or many a times it can undergo silencing also.
Right.
And to understand this component of gene regulation or gene expression, okay, transcriptomics plays a very, very crucial role, sir. And hence, that's the major component. And the entire world, especially in pharma, they are behind transcriptomics because they want to know to control a disease or a disorder.
So, sir, I'm sure transcriptomics also generates a lot of data.
Right, sir.
How do we validate that big pile of data?
Again, validation of transcriptomic data, it is very much done using bioanalytical tools.
Right.
So we are using analytical tools, and with that, but when I say bioanalytical tools, example, I can validate it using PCR. I can validate it using 2D pages. Okay, I can validate it using microarrays, macroarrays. So ELISA techniques, fluorimetric techniques. So all these are various techniques which will help us in understanding the validation of the data, sir. So as I told you, it is a big heap of data, but removing, and trust me, sir, when we actually do the sequencing component, especially RNA-seq or DNA-seq, we get 100 tons of data. And in this 100 tons of data, 70 to 80% is junk. It is a wasteful data. It is multiple times red data, which we call it as chimeras.
Okay.
Now, when we are trying to do genomics or transcriptomics, removing this chimera from the readable data itself is a very big job. And lot of companies, example, Straits, Biocon, AstraZeneca, all these, they require students who are able to classify this data. Because, once I classify this data, I would start my, the analysis from the readable data, and classification of this data becomes very, very crucial for the analysis.
Wonderful. That really opens a new door of opportunities to the students, because big pharma is into this.
Right.
So, sir, the next step would be obviously proteomics.
Right.
And when we say proteomics, it is related to genomics and transcriptomics. But how would this relation help us to move further in our research? If you can throw some light.
Absolutely, sir. Absolutely. The protein is the end product.
Right.
Now, once we have this end product, all the companies, especially there is something which is called a scale up and scale down. So for any kind of scale up or scale down processes, I require the protein component. And, Biocon became Biocon only because of, the fermentation technology. So again, this could be employed, this technology could be employed on proteins either. And remember, sir, we are not talking about protein as per se, but certain proteins are catalytic in function.
Right.
Now, these catalytic proteins are called as enzymes.
Right.
Now, the entire world of enzymes will open up. Now, if you are a biochemist, if you are a biotechnologist, and then if you are a molecular biologist, if you can manipulate a gene so that the end result, you will observe it in a protein,
Right.
and then this upregulation or downregulation of RNA component, you will see it in the upregulation or downregulation of the protein component. And this is how, you can upscale a protein or downscale a protein.
Downscale it.
So in turn, you are actually playing into the modulator of the end product. So this again is a very, very huge component.
We can design an enzyme, ultimate enzyme.
Absolutely, sir. Absolutely, yes.
Right.
And also when we are looking for a drug interaction, okay, we are actually looking at the end product, that is the protein. Because right now in India, we are not that proficient with gene therapy. So right now what we are trying to do is, we are trying to target the protein component. So every pharma, every drug designing company, they are looking for how exactly a protein interacts with that of your ligand molecule. It could be a ligand molecule, could be a chemical molecule, it could be a retrochemical molecule, or it could be a phytochemical molecule. So there's a huge market for this.
All right. So, sir, now we know proteomics and how it is getting us the end result. But you mentioned metabolomics, where there is a metabolite and the end of this. So, how would this all come into the same picture? Metabolomics now into this picture.
Again, a great question, sir. So now, once we have the protein could be a mother protein. Right. But however, this mother protein can undergo catalysis, or a chemical reaction. When it undergoes a chemical reaction, this gives a byproduct. So from the one major source, you have multiple byproducts. And trust me, sir, all these are not behaving in the same way of that of a mother protein.
Okay, so it breaks down.
It breaks down. And each protein, either it can remain as a protein or it can become a small domain of that catalytic protein.
Okay.
So this is how this, the upregulation of downregulation of these small catalytic metabolite, which could be an anabolite or could be a catabolite, can play a predominant role on the health of a given individual, sir.
Right.
You could take it as a bacteria, you can take it as a plant, you can take it as a nematode, or murine model, or humans. So hence proteomics and metabolomics, there is an interplay between proteomics and metabolomics, and hence
all of these are
very important
connected.
Role.
Right?
Everything is connected. So.
Okay. So, sir, suppose I'm explaining all this relationship to a 7-year-old kid who has no background in biology. How would we go ahead and explain from there to here?
Great question, but also a difficult question, sir.
Yeah.
Okay. So I would always explain this in a form of a spider web. Okay, because everything has been associated with each other. So we'll start with the center of the web, which is your genomics. And from there, because the child should know where did the child come from and why exactly, the smile of that child resembles the father or resembles the mother. And that with that connectivity, we can say that, okay, now, many a times, the moment the baby is born, all the relatives will pop in and, there is some resemblance, strategy which plays around. Now, why is this resemblance? Okay, so this is mainly because of the sharing of the genes. And very importantly, we can also make this, the 7-year-old kid, not with exact terminologies, but how exactly what is meant by, semi-conservative replication module. So that it understands that, okay, I have come from my mama. Okay, so there is a relativity. And how did that happen? That is with a component, which is called a gene. And from gene, then we can build on using that particular web.
Okay, wonderful answer. Sir, you also mentioned before we started this discussion about epigenetics.
Right, sir.
So how does epigenetics come into picture while all this is happening?
Again, until last 10 to 15 years, people did not think about this, sir. Okay, as people, they said that, the entire story started with something which is called as DNA. But now, from the last 15 years, what people are looking at is, there is something which is actually controlling the DNA.
Right.
without becoming the part of the DNA. That's the specialty, sir. Okay. And one such component is, they are called as microRNAs. We call it as miRNA. Now, this miRNA are the epigenetic marker. So for any kind of a gene, so there is an epigenetic marker which is controlling the gene.
Right.
So it might be, and you'll be surprised to know that it could be even an habit or an habitat changes which are picked up at epigenetic level, and from an epigenetic level that has been transferred onto DNA level. So a better analogy would be, example, if imagine my father and my mother both are diabetic. Now, what are the chances of me getting diabetic? And because I now know my clinical history, I will make all the precautionary measures. I would take up all the precautionary measures with all good exercise, with good diet, everything. But on the way, still I am prone for 40% of me becoming diabetic. Now you can ask me, sir, you took up all great care of your body, but why did you become finally why did you get diabetes? Now this is mainly because of my epigenetic biomarkers like microRNAs. Okay. So hence, these are the microRNAs, and many a times we say that, oh, this is a hereditary disease, or this has been, it is a gift from your parents. Okay, so those gifts, they come in small packages which are not coding, and these small packages are called as, microRNAs, which are the major study of interest, especially in epigenetics, or it is also called as epigenomics. Right. I'll also give you another example. If you observe a particular family, in a particular family, they will be having, father would have expired with heart attack, son would have been expired with an heart attack, his son will be expired. Now, there is a particular line of, pattern, and this pattern is being followed when we trace back. So there are certain epigenetic biomarkers which are responsible for, accumulation of cholesterol in the entire family.
Is it?
So like this, we can actually go back because this has been governed by your habit and your habitat.
Right.
So hence epigenetics plays a very, very important role.
So my question now is, okay, let's start from proteomics, genomics, and till here. How can we apply all of this knowledge into the commercial aspect, into a biotech company or a pharma company, and develop products for the human race?
Absolutely.
What's your take on this?
So when we look into a biotech company or any company per se, revenue generation model would be the major criteria.
Right.
Okay. Yes, there should be two major components. One is what is the significance of your research, and what is the revenue which is being generated. Right. Example, when I talk about significance, it is again divided into two major classifications. What is the scientific significance and what is the societal significance? Right. So this should go as the philosophy part of the business. Right. But however, when a biotech company is actually looking for business, it is looking for a revenue generation model. Now, sure. How exactly, with your knowledge, how exactly you can imbibe that into development of products? Now, these products could be of a diagnostic method, or it could be of a detection. It could be for therapy, and this could be even for prevention. So right. Any of these components, if you are able to bring in with your knowledge of bioinformatics and biotechnology, any company will just absorb you. And there's always a wrong notion saying that, oh, biotechnology companies are all saturated, and we will not get jobs.
That's right.
It's absolutely wrong, sir. Okay. Normally, if you have brains, and if you have understood, not read, if you have understood the biotechnology at a deeper concepts, at a deeper level, sir, the jobs will come to you rather than you going for a job.
Right. Let me tell you about this. So we were at a CEO's meet, and I'm talking to so many people and asking the same question. Like, many people complain that there is no jobs in the biotech sector. They were like, rather we should complain that we are not getting employable graduates and postgraduates who have the right skill set.
Absolutely.
And now when they're not getting the right skill set, ready people, they are not able to scale up because they don't have the right manpower.
Right.
Now, biotech is mainly research driven. So research will always be done by humans.
Right.
And when the humans are themselves not equipped, how will they do the research?
Correct.
Right. That was the biggest complaint they all had.
I agree, sir.
Right. So I think
and even when we are looking for companies, they are looking for productivity with a given span of time, because
right.
they cannot have a leverage of the leisureness and then layback attitude,
right.
because they have invested and there is a demand which has to be satisfied.
They should get the return over investment.
Absolutely,
as simple
yes.
as
Absolutely,
that.
yes.
If they're investing X rupees in you, they deserve to get 10X from
Correct.
you. So that's how they all relate. That's
right.
how the companies, right. the industry works.
So
right?
unfortunately, this revenue generation model or this facts is nowhere covered in your regular curriculum.
Exactly. So the students don't know why they are getting a job.
Right.
They're not getting a job to work there. They're getting a job to increase the revenue of the company by 10 times.
Right, sir.
Otherwise, they will not hire you. But if you are not ready to do that, they will not hire you. That's how it is.
And many a times, first rank student in the class, they will complain that I have not got a job.
Yeah.
Okay, because they have read the textbook well, but they have not understood the concepts well.
They have mastered the scoring system.
Exactly.
They've not mastered the concepts.
Right, sir.
That's
right.
what I will say. Yeah.
And it is easy for a 70% student or a 60% student to get a job, because because with my 16 years of teaching experience, I have seen that 60% or 70% student who have understood the concept at least 70%.
Yeah, I sorry to interrupt. I remembered examples, so I'll tell you guys. So
please, sir. Because when you quote examples, you will give live,
real live example I'm giving you. CSIRNet first ranker,
right,
got rejected from IIC Bangalore, went back. Now she's teaching in a coaching institute.
Right.
Because she's not getting through the interviews, because she's just mastered how to write CSIRNet.
Correct.
She's not having the concepts.
Right.
While my student who is having 112 rank got through in IIC Bangalore.
Right.
How? Because he had mastered concepts.
Right.
Rank doesn't matter. Marks doesn't matter.
Absolutely,
right.
sir.
Another student I know, he had a 5th rank. 5th rank means, okay, very good, CSIRNet 5th rank. He got rejected in the interview. But my student who has got a 233rd rank, he is getting selected.
Absolutely, sir.
Now this student came to me, sir, I got selected, he didn't get selected. Why? Because you have mastered concept, he has mastered marks.
Exactly.
Right. So I think that's what is happening. Anyways, come back to the topic which we're talking today. So you mentioned about, okay, molecular docking is one thing which is your favorite topic you teach. So, and of course, drug discovery, it is used. So if you could throw some light, because this is a commercializable aspect of the industry, molecular docking being used in drug discovery, how fast this will scale and how it will grow in the future?
Okay. When we have this one-to-one talk, we feel that, okay, you have, everything is so systematic. You can have just one ligand molecule, one target molecule. Then you will see what exactly is their compatibility. And once you do that compatibility, okay, there's a eureka moment. There's a new drug. That does not happen in biosciences.
Right. It doesn't happen.
It doesn't happen, sir.
It's not a push a button and get a result.
No. Because all molecules, especially all biomolecules, are fickle. Okay, so in a test tube they will behave differently. Right. In a living system they will behave differently. In a fermenter they will behave differently. And on my in silico model, that is on my computer, on my silicon chips, they will behave differently. So many a times when we start our high throughput sequencing or high throughput screening, we would start with 10 lakh molecules, okay, or 1 million molecules. And when we start with that, okay, at least you have a hope of getting one. Right. And trust me, sir, many a times we don't even get that one.
Of course.
Okay, and hence, this high throughput sequence, there's a lot of manpower. No machine can actually take up this role. Okay, though there are a lot of automated system pipelines which have been generated, but there is a need of human intervention, because the psychology of these biomolecules has to be understood by another human itself, but not with a machine. And hence, there's a huge market, huge demand. Forget about docking. There's a huge demand for designing molecules. These are called as designer drugs. Okay, wherein, example, we all know that for malaria, there was a beautiful drug which was from a phytochemical source, which was called as quinone. Okay, but however, somebody, sat on a computer and then they thought, okay, if I just attach a chloromolecule, onto a quinone, it becomes a chloroquinone.
Right.
And this chloroquinone is 1,000 times much more potent than compared to your quinone. Yeah. So that is how, this process is called a derivatization.
Right.
Now, especially in drug discovery, I would try to, illustrate this to all our subscribers and students that, it is not just into the molecular docking component wherein you can become employable. You can also look for designing of just ligand molecules. And this process is called as designer drugs, or they are also called as biosimilars.
Right.
Now, apart from that, once you have the biosimilars, identifying targets also is the next job. Now, how do you identify the targets? Understanding pathways. So designing pathways itself is an individual unit in a given company. And that is how, amalgamating all these different domains, finally there comes a job of a docker. Right. Wherein you have the ligand and the target, and finally you have the docker.
That's the future job.
Absolutely,
molecular docker.
Absolutely.
Right. Right. So, sir, in many of your videos, even in my videos, I have talked about AI and ML, that is artificial intelligence and machine learning, being used in the drug discovery pipeline. So, if you could throw some light on how this will work in the future and what scope and future opportunities it will open for bioinformaticians.
Absolutely, sir. So many a times, as I told you, we have like 1 million molecules, and screening them with human intervention becomes difficult. And here comes the advent of technology. And trust me, sir, AI and ML and deep learning has made a tremendous improvement, wherein at least now, out of that 1 million molecules, at least I have hope towards at least 10 molecules, which could be a lead optimized ligand molecule. So here, our students, it is not just because people are not looking for just a biotechnologist. You need to be a computer scientist. You need to be a statistician. You need to be a mathematician. Okay, you need to be an docker. You need to be a coder.
So the expectations are huge.
Very, very high, sir. Expectations are very, very high. And trust me, sir, as the expectations are very, very high, the packages are also very high. The salary packages are
because
also
it's unique. It's nowhere available.
Absolutely, absolutely. Now, if you go as a biotech student with just biotechnology, whatever you have studied from your MSc, you get a job package of around 15 to 20,000 rupees as a fresher. Okay, not exaggerating the package. Okay, so this is the reality part. But however, when you are empowered with all the other subjects, and when I say empowerment, you need not to spend around 2 years or 3 years in studying AI.
Right.
Okay, so with now Chat GPT and other things, you already have the components, but on the way you need to assemble it. And how do you assemble it? You need to have that knowledge of doing it. So for this, what you need to do is you need to empower at least for 3 months, at least for 2 months, at least for a month if you do not have time. But intense understanding is very, very important. And here comes the role of your internships and certification programs.
So I totally agree to that. So, sir, what we're looking at is a person who's coming out of MSc biotechnology or any MSc life sciences curriculum. He is not at all aware of all this. He is just coming as a unbaked cookie.
He thinks that it is like a pipeline.
Yeah.
First standard say 5th standard aa gaya, 5th standard say, then you have the 10th standard to 12th, and then you have a degree, you have a master degree, and then at the end of the pipeline, somebody is actually waiting with an invitation saying that, oh, please come, there's a job for you.
But
this will never happen.
That won't happen because the people who are looking for you always have a choice.
Right.
But you have to become their ultimate choice.
Right.
And if you want to become their ultimate choice, you have to get in with the unique skill set.
Exactly, sir.
And that I have seen, that certainly I agree to. So, sir, okay, we now know a lot about genomics, proteomics, epigenetics, epigenomics, all that. But where does CRISPR fit into this? Because you are taking a CRISPR internship right now.
Right, sir. Sir, until now, whatever we spoke about was with regard to chemistry and with regard to, biochemistry and other things. People are not happy with it. People, they don't want to compete with the chemical component of nature. People want to compete with the nature itself. Okay, so now initially there was a competition for a job between you and me, like humans. Then it was between males and females. Then at one point of time, females actually dominated the biotech sector. Okay, now the competition is with God.
Okay.
And when the competition is with God has created, all organisms, with that as a mythological definition. Okay, God has created organisms. But however, I see a defect, or I'm greedy enough to do something which is more than what God has actually done.
That's what we recently posted, that in future the babies will be born out of eggs, like an eggshell.
You never know, sir. Any crazy idea can come up, and you'll be surprised to know, because you spoke about CRISPR. CRISPR is now you have the gene in front of you, okay, or the entire genome in front of you, and in one hand you have an eraser, and then in another hand you have a pencil. Okay, any component in this particular gene you don't like, you can erase it, and then you can draw as you want.
Whatever you want.
Okay, and that can lead into, because you're talking about the gene, that can lead to a profound effect into transcriptome, proteome, metabolome, the genetic makeup, that is the genotype or the phenotype of a given organism will entirely change. Example, I can grow tomatoes in Antarctica.
Right.
Okay, or I can grow potatoes at Siachen. Okay, so, or, we are greedy in terms of appearance, we are greedy in terms of looks, okay, and we are also greedy in terms of IQ.
Right.
Okay, so with this CRISPR technology, because now I know your anxiety is related to genes, your depression is related to genes, okay, your looks have been related to your genes. So now, I don't like my skin color. I can just go edit my, entire melanocyte and keratinocytes, and then, whatever color you want, you can just have it. Okay. And now, from the time immemorial, Newton or Einstein are been found to be the greatest scientist what the world has seen. Okay. And if there is a small segment of their gene, I can just edit that particular gene in my baby. Okay. And there is a concept which is called as personalized babies. Customized babies, designer babies, all these are like new terminologies. And a few days back I was just looking into research data. Until now we need to have a male and a female to produce a zygote. Right. Okay. Now there is a point wherein you do not require, previous to that you require at least a surrogate mother. Right. Who can lend the womb, and that is how the process would take place. Now there is a point wherein if you just give me your skin cells, just the skin cells, not the gonadal cells, just the skin cells, we can make it a point that we can make thousands of shaker cells exactly replicating, as you, and also can make much more intelligent than what we are. Right. So, but on the way, we need to also think about what are our ethics. Right. Now, just imagine there's another shaker cell sitting next to you. Okay, what is the identity of that shaker cell?
Yes, it leads to a lot of ethical questions.
Lot of ethical questions.
But let's not get into the ethics of it right now, because this particular session is all about career and future scope.
Now, what I'm trying to tell you is there's a lot of scope.
Yeah,
there's a lot of scope.
Definitely, it is. It is
and,
there.
Beyond imagination. Scope beyond imagination.
Right. So let's try to now conclude, because it's been a long conversation so far. Because I'm sure our audience must be tired. So, what is your take on the future of a bioinformatician or a biochemist or a zoologist or a botanist, anybody who has just learned bioinformatics from you or anywhere?
Right.
What will be his future on a scale of 0 to 10? How much can be his earnings? How fast he can grow in his career?
Right, sir. As we discussed from the last 30 minutes, now people are not looking for zoology, botany, biochemistry, biotechnology. People are looking for a package. People are looking for a life science student. Mm-hmm. And when we talk about life science student, a life science student with computer aided, with computer knowledge, empowered student. So here comes the very, very important role of biotechnology and bioinformatics. So we need to have a great hold, a great grip on the technology aspects also and the biology aspects also. Now, if I want to rate a student between 1 to 10 with a comparison of just a passed out student and an empowered student, a passed out student could be somewhere around 3 or 4, sir. Mm-hmm. You might feel, sir, why so low rating? Because they have a degree, but they're not employable.
Right.
But on the other way, when you have been empowered, I can still say that you can have a rating of around 7 to 8, but not 10, because
there is always
a learning curve. Absolutely. And then the companies will actually have an induction program for you, so that, as per their requirement, they will train you. And hence that particular 7. But just to tell you, sir, we are not getting even students with a rating of 5.
Right.
Okay, so there is a huge demand, but there is no supply.
Right.
And so the threshold is not being met.
An education system always takes its own sweet time to turn towards the industry. Okay. It will take some time. By the time they will change the curriculum, the industry would have moved on 10 years ahead.
But just to tell you, sir, during that flip, that student of that particular generation is the sufferer.
Yeah.
So hence, it becomes very, very important, rather than becoming that victim of that particular situation. Okay, we need to make that situation as an opportunity and then learn.
Certainly.
Okay, that's the thing.
Every adversity is an opportunity, like we say. So that was Farhan Zameer, sir, and he shared all the amazing, tremendous insights into the world of bioinformatics, genomics, transcriptomics, proteomics, and CRISPR, and whatnot. His experience and expertise you could visualize right now when he was speaking. Now, one very important aspect which I would like to say before we conclude is, sky is also not the limit for a bioinformatician. And if, as a bioinformatician, you complained earlier when you got into biology, you complained that I should have gone into IT field by mistake, I got into biology, it's a mistake. Here is a chance to come at the boundary of IT and BT, and that's called bioinformatics, and build a career where you are multidisciplinary, interdisciplinary, intradisciplinary, and ready to take on whatever challenge may come your way. So no matter which science you studied, you can always study bioinformatics and apply it in your research domain. So that's all from our side. Thank you so much, sir.
Thank you, sir. Thank you very much, sir.
I
It
know.
was a delight to talk to you, and thank you very much, sir.
It was amazing interacting with you, sir. And always I learn newer things. Today I learned newer things and terminologies. Thank you so much. I'm sure you have a busy schedule, so please go ahead. And I'll catch up with you later.
Thank you, sir.
So students, that was Dr. Farhan Zameer, sir. Thank you so much for joining. I'll see you soon in the next one. Till then, take care. Bye-bye.